Welcome to this short review of type 3 hypersensitivity, where immune complexes deposit in tissues and drive inflammation. Hello, I'm Christopher, and in this video we'll talk about how a normal antibody-antigen interaction can become a problem when the immune complexes form, circulate, deposit in tissues, activate complement, and recruit inflammatory cells. The short version is Type 3 is an immune complex hypersensitivity. Type 3 hypersensitivity is driven by soluble antigen-antibody complexes. This differs from type 2 hypersensitivity, where the antibody binds to a target fixed on a cell surface or tissue. In type 3, the soluble antigen and antibody first form an immune complex. Now, this happens all the time, and when these complexes are cleared efficiently, they don't cause disease. The problem occurs when complexes persist, circulate, and deposit into tissues. This scenario is favored by persistent soluble antigen, often in a relative antigen excess, which can promote smaller soluble immune complexes that are harder to clear. Once these complexes deposit in places like vessel walls, glomeruli, joints, and skin, they activate complement and recruit neutrophils. That inflammation is what causes tissue injury. Thus, the key idea is not simply antigen plus antibody is bad. The key idea is when immune complexes form in the wrong place, at the wrong amount, and with poor clearance. In small animal medicine, the clearest vaccine-associated type 3 example is the localized Arthus reaction. This reaction is named after Nicholas Maurice Arthus, who described local inflammatory reactions after repeated injection of horse serum into rabbits. An Arthus reaction occurs when antigen is introduced into a patient with pre-existing antibody. Local immune complexes form at the injection site, activate complement, recruit neutrophils, and cause localized inflammation and tissue injury. Clinically, this may appear as localized swelling, pain, edema, and in some cases, ischemic injury and alopecia or hair loss at the injection site. The inflammatory injury may begin within hours, but the owners may not know the alopecia until days later. Rabies vaccine is often discussed anecdotally in small animal medicine, but an Arthus-type reaction is not limited to rabies vaccines. The key mechanism is local immune complex inflammation after antigen exposure in a patient with pre-existing antibody. The important distinction is that this is not type 1 anaphylaxis. This is a local immune complex reaction. Type 3 hypersensitivity can also be systemic. A classic veterinary example is purpura hemorrhagica in horses. Purpura hemorrhagica is an immune complex vasculitis, or inflammation of the blood vessels, classically associated after exposure to the bacterium Streptococcus equi, the agent of strangles. It can follow natural infection and has also been reported after vaccination in previously sensitized horses. In this disease, immune complexes deposit in vessel walls and activate complement. The resulting vasculitis can lead to edema, petechia, ecchymosis, mucosal hemorrhage, limb swelling, ventral edema, and in severe cases, skin sloughing or more widespread tissue injury. This is not an Arthus reaction because it is not just a localized injection site event, but is still a type 3 hypersensitivity because the injury is driven by immune complex deposition and inflammation. Type 3 hypersensitivity can be local or systemic. A local example is the Arthus reaction, where immune complexes form and deposit near the site of antigen exposure, such as an injection site. A systemic example is purpura hemorrhagica, where immune complexes circulate and deposit in vessel walls throughout the body. Other type 3 patterns include diseases such as serum sickness, immune complex vasculitis, glomerulonephritis, and some forms of immune complex polyarthritis. The unifying principle is simple. Type B injury follows where immune complexes deposit. To summarize, type 3 hypersensitivity is immune complex mediated. Soluble antigen binds antibody, forming immune complexes. If those complexes persist and are not cleared efficiently and deposit in tissues, they can activate complement, recruit neutrophils, and cause inflammation. Local type 3 disease can appear as an Arthus reaction. Systemic type 3 disease can appear as immune complex vasculitis, serum sickness-like disease, glomerulonephritis, polyarthritis, or purpura hemorrhagica. The clinical signs depend on where the immune complexes deposit. Thanks for watching. I'm Christopher, and what you understand today helps you protect patients tomorrow. I'll see you in the next video.